Welcome to the 11 Alert Desk. I'm Aspen Andrews, digital content producer, and I'm here with Steve Carleton, Chief Clinical Officer at Porch Health. And with September being Recovery Month, Steve and I just wanted to hop on today to talk a little bit about treatment and recovery for substance use disorders. So Steve, first, could you give us an update on where the fentanyl crisis is, both in the US and in Colorado as well, and some of those latest trends you might be seeing?
Yeah, absolutely. We just passed Fentanyl Overdose Awareness Day about a week and a half ago, and yeah, we do have some positive news. There's been a pretty significant decrease in the number of fentanyl overdose deaths in 2024 with that provisional data, and then those trends are seemingly continuing on into 2025. So we're seeing a decrease in the amount of people dying from fentanyl overdose. It's still about 80,000 per year, so still some work to be done, but we're making progress.
Yeah, and when we talk about the opioid epidemic, there's a lot of times that people might mix opioids with alcohol. Could you talk a little bit about that?
Yeah, so it is actually pretty common. So when we look at overdose and overdose deaths, both of those segments of people, what we see is just under 20% of those overdoses, alcohol is involved, right? And so it's really important just to understand that opiates and alcohol, they're different types of substances, but they both depress respiratory activity. So they both sort of depress your breathing rates, and so um, that can potentially be harmful and even deadly if you're using copious amounts of both.
And on the other hand, focusing on alcohol, a lot of times we don't talk about it because it's so widely accepted. But why can alcohol cause so many deaths?
Yeah, so when we look at substance use treatment in general, what we know is 60 to 70% of the people that are seeking care for alcohol, right? We talk a lot about fentanyl, we talk a lot about cannabis, stimulants like cocaine and methamphetamine. Alcohol is the legal one, right? And so people's access to alcohol is obviously much easier. You can go and buy it legally in a store, right? And so for that reason, it's more socially acceptable. So you see this at parties and you see this at sort of virtually any restaurant you go to. And so alcohol is still the most common substance that people use and are at highest risk of developing a use disorder with.
And what are some of the signs that someone might be overusing, and when do you think it needs to be addressed?
Yeah, great question. So when we think about alcohol misuse and alcohol use disorders, there's a few things that we're really looking at. Obviously, first and foremost is physiological dependence. People always talk about sort of you need more to get the same effect, right? Our tolerance. They think about withdrawals, which is what happens when that substance goes away. People starting to get ill. Those are the most common sort of signs. But the other really important ones to note are experiencing a loss of control, right? So you're using more than you intend to over a longer period of time. I said I was only going to have two, and before I know it, I had six to 10. Um, Experiencing significant cravings and strong desire to use. And then obviously social and occupational consequences. When people are using too much alcohol, it causes problems in relationships and people don't perform and meet their responsibilities and obligations as well as they would if they weren't abusing alcohol. And then lastly, just risky use, falling, drinking and driving, using, sort of knowing that it's causing sort of worsening depression and anxiety. All these can be sort of signs that alcohol and or any substance for that matter is getting to a problematic state.
Yeah, and kind of on the other hand, how could someone who may be drinking too much but might not have an issue per se cut back?
Great. Yeah. So when you think about cutting back, right, a lot of people don't take the time to set limits for themselves. And what we know is anytime people are going over 12 in a week, like that's when you're actually causing damage to your brain. That's when you're causing uh, damage to your liver, right? This is sort of some of those signs that you're having trouble, right? And so just think about a budget for your drinking, right? Like, are you somebody that wants to drink one or two a night? right? Are you someone that wants to sort of go bigger on the weekends and not on the weekdays? What we know is if you spread out those 12 across a week, like we know there's no safe amount of alcohol, regardless of how little you drink, it's going to have a negative impact, but um, you know, 12 or less, not as concerning and not as problematic for your brain and your relationships.
Yeah, and how might someone talk to like a family, friend, or loved one about it?
Just approaching people with compassion is a really good place to start. I think the tendency, if you're worried about a family member, is to go at them pretty strong and to bring it up a lot and bring it up often and bring it up maybe when they're drinking or intoxicated. And that's just really not a great time to do that. You're not going to have great outcomes if you're sort of bringing it up all the time and you sort of just become a squeaky wheel. What the best thing to do is organize a time when that person's not going to be intoxicated and when it's more likely to be calm, and approach them with acceptance, love, care, compassion. Tell them you're concerned. Ask them if they are interested in help or would like help from you in finding some help. I think these are good ways to approach it.
And as we wrap up, is there anything else you'd like to talk about when it comes to Recovery Month?
No, Recovery Month, like, so it's really important during Recovery Month that we kind of hit at the root of what recovery is. Recovery is sort of getting something back that you lost, right? Recovery is helping people find something to run towards. What we know, and especially in addiction treatment, is people only get so far if they're running away from addiction, right? We have to find something that people are running towards in order to help them get better and to get the maximum benefit from treatment. And so recovery is about running towards something. That would be my last message.
Great. Well, where can people go to get help?
Porchlighthealth.com is a great resource. If you are in the Colorado Springs area or somewhere in Colorado or New Mexico, 866 MATSTAT is our phone number, and we're great at getting people in as quickly as possible. A lot of people that call, we can get in within 24 hours. So those are great places to start.
Great. Well, thank you, Steve, for coming to talk to me a little bit today. I appreciate it.
Yeah, thank you, Asma.